recently been diagnosed with epilepsy?
Epilepsy is whenever cell activity in the brain is disrupted, resulting in your seizures. There is no cure, but it can be controlled with medication and exercise.
Here are some statistics on epilepsy. 1.2% of people in the U.S. have epilepsy, approximately 3.4 million nationwide, and more than 65 million worldwide. 1 in 26 people develop epilepsy at some point during their life. Epilepsy is the fourth most common neurological disease. The incident rate is the highest in young children under the age of 2 and adults 65 or older. Here is a map of the prevalence of epilepsy in the U.S. as of 2015. The darker the color, the greater the number of cases of epilepsy in the individual state. There are a few different types of seizures associated with epilepsy. There are 5 generalized types of seizures which come from many parts of the brain. Absence seizures is normally 2 to 15 seconds of staring with limited responsiveness. Atonic is less than 15 seconds with loss of muscle tone. Myoclonic is sudden jerks of muscle, and tonic-clonic can last 1 to 2 minutes with convulsions, loss of consciousness, stiffening and or jerking of upper or lower limbs, tongue biting, drooling, bladder bowel inconsistency, and confusion after seizure.
Partial seizures occur when the seizure activity in the brain comes from a particular known location in your brain. There are 2 types of these partial seizures. The first is a simple seizure, where the person remains alert and responsive. This can occur before a tonic-clonic seizure. The other type is a complex seizure. These have a variety of symptoms, including staring, loss of consciousness and recall, smacking the lips, arm movements, grunting, repeating words, undressing, or walking or running suddenly. These occur for less than 15 minutes. You may be wondering, what is causing my seizures? While the exact mechanism isn't known, there are some ideas about how these seizures occur. It is thought that these seizures are largely due to neurotransmitters in the brain. You may be asking, what are these neurotransmitters? These neurotransmitters are GABA and glutamate. GABA is the neurotransmitter that decreases the activity of a nerve and its conduction, whereas glutamate increases the activity of a nerve and its conduction. It is thought that some damage in the brain occurs to the nerve cells. This then changes the ability of these nerve cells to release and control the neurotransmitters GABA and glutamate, which cause an imbalance of them in your brain. This imbalance increases the electrical activity, which causes your seizures. The good news for you is that while the mechanism behind the benefits are unknown, exercise has been shown to be effective at decreasing the frequency of seizures. The ability to interact with others during exercise has the additional benefit of increasing your socialization and increasing your quality of life.
With epilepsy, there are a few considerations that you should be aware of. After exercise, there is a higher risk of seizure, especially if you are new to exercise or not currently active. Due to an increased risk of seizure, you should always be supervised in case of an event. Be aware of any side effects that your medication may have on your condition, and also be aware of any activities that would be risky in the event of a seizure. For example, swimming, diving, and or motor sports. Avoid heights and do not rock climb unsupervised, and use a helmet and or life jacket when necessary.
Common possible side effects with epilepsy medications that you should be aware of with exercise include fatigue, dizziness, tremors, blurred vision, as well as stomach upset or discomfort. It is important for those around you to know how to react in the event that you do have a seizure. The Epilepsy Foundation has created this pamphlet on seizure first aid. It is recommended that those close to you become familiar with this. It is important that they know to stay with you until you are awake and alert and they know you are safe. They also should know how to put you in the recovery position in the event that you lose consciousness. This entails putting you on your side, loosening the clothes around your neck, and putting something soft and small under your head. It is important that they know not to put something in your mouth, as the myth you can swallow your tongue is false, and inserting something into your mouth can be dangerous to you. It is also important that they know the criteria of when to call 911 for help. This criteria includes if the seizure has lasted more than 5 minutes, you do not return to your usual baseline, you are injured, pregnant, or sick, you are having repeating seizures, having difficulty breathing, and if a seizure occurs in the water.
Remember to always wear your medical bracelet in case of an event. It will allow those around you to get you the help and attention that you need. Unsure of what you should put on your medical bracelet? It should include your first and last name with your medical condition and/or conditions. It should list your current medications and any consideration or restrictions to your treatment. And most importantly, it should have an emergency phone number to call if an event occurs. For more information on epilepsy, a good resource is the Epilepsy Foundation at epilepsy.com. Here, you can find more information about epilepsy, as well as find the Epilepsy Foundation for your state, which can lead you to camps and support groups.